You are watching the DocTalk show.
Welcome back. We are discussing diabetes, and we have learned that diabetes is a condition of high blood sugar that may be attributable to several factors, including genetics or high blood pressure, high weight, or high cholesterol levels. And diabetes is one of the most common causes of heart disease, strokes, kidney disease, and can cause blindness. Given the severity of this diabetic condition, it's always important for people to know how to manage diabetes if they have it, and if they don't have diabetes, how well they can protect themselves from getting this disease. So maybe we'll start with helping the people who might have diabetes, how they can bring their sugar levels to good control.
We believe that diabetes education is crucial for self-care with diabetes. So we tell you about your feeding, the role of exercise, foot care. We tell you about the role of your drugs, whether they're tablets or insulin. And we tell you when you're sick, what do you do? Because we know that actually self-care, education comprises 60% of all the work we need to do. However much we give you drugs and we've not given you the diabetes education, you will not get to the targets.
Actually, dietary education or diet nutrition is a pillar in diabetes management, because many of the food we eat contributes more than 60% to the blood sugar. So when they come, we tell them to regulate the amounts of food they eat. The portion size is very important, most especially when it comes to starch food, the carbohydrates, the cassava, the bananas, the matoke, the kalo, the posho, the rice. We first educate them there to tell them how much of those they need. We tell them to take plenty of vegetables. Vegetables have an advantage of making your stools soft. They help the act as roughage to prevent one from getting cancer of the colon, in addition to reducing blood sugar. At the same time, the vegetables make your stomach full, but in the end, once the stomach distends or becomes big because of the vegetables you've eaten, your appetite center switches off and you take a less amount of food. So vegetables are very important. We tell our patients to take fruits in moderation. Yes, fruits are good, but we don't want our diabetic patients to take them, to take too much of it. Okay. We ask them to take low amounts of refined sugars. What we mean by these things like cakes, we advise them to leave them, ice cream, these refined drinks which are sold in supermarkets. By the way, we even advise them not to blend fruit, because if you blend fruit, what is going to happen? You are going to put the fruit with this fiber in your blender. You break the fiber, then you get a sieve and you remove the fiber. Then the drink you have is as refined as that one which is sold in the supermarket. So we want them to eat the fruit whole. And of course, this one is debatable. Even then, we tell them to not to take fruits that are too yellow.
For
yellow.
Example, which fruits?
For example, banana. A mango. If you taste a mango which is yellow, you can take as many as you want because they are sweet. But one which is green or half yellow, you are not going to take a lot. We believe that the glycemic index, so the amount of glucose in a very ripened fruit, is not as much as that one in in a green one.
Okay.
When it comes to dietary, ideally we ask our patients to come in contact with a nutritionist, and in most cases, what one eats depends on their age, the type of work they do, and sometimes even the type of treatment they are on. Are they on insulin? You might find that the instructions are quite different. Are they on tablets alone? The instructions might be different. Are they on both insulin and tablets? Even the instructions might be different.
Okay. I think also limiting the alcohol is an important
Exactly.
step in
Yes,
the
sir.
nutrition management of
Exactly.
diabetes. So, Dr. Puloya, we understand that exercise, there's advocacy for exercise, and we wonder how much exercise should a diabetic do?
30 minutes a day is really doable. And this could be both aerobic exercises and muscle strengthening exercises. Sometimes we call them resistance exercises. So exercise has been found to actually increase your muscle sensitivity to insulin. So it's actually been found that people who exercise and are diabetic, they may need less insulin or less drugs to control their blood sugar. They will have a better blood sugar control. We've seen some having to even get off the drugs when they start to exercise. It improves their cholesterol, and it actually also reduces weight for some of them.
So exercise really has very important, exercise plus nutrition would be the cornerstones for diabetic management, in addition to the drugs.
Yeah.
Maybe Dr. Lumu can help us understand some of the drugs that, I know we can't explain all the
of
drugs
them.
on the show, but what would be the key learning points
key
when
learning.
it comes to taking?
I'll start with, let's say, type 1 diabetics. As earlier discussed by Dr. Teresa, these ones don't produce insulin at all. So in these ones, they have to be on insulin. We need to replace the insulin because the insulin that they're missing. So there's no room for tablets in patients who have type 1 diabetes. Now, type 2 diabetes, early on, sometimes start them on insulin. Then when their blood sugars try to normalize, when the blood sugars try to normalize, sometimes we put them on tablets. And also there are sometimes when we start them right away on tablets and then we change them to insulin. So in brief, in type 2, we oscillate between tablets and insulin. In type 1, we only use insulin.
And how often should people monitor their blood sugars?
For patients who are on insulin, the monitoring of blood sugar at home, what we call self-monitoring of blood sugar, should be more regular. That's why we advise every diabetic who is on insulin should have a glucometer to help them monitor their blood sugar. And even then, when they monitor, it depends on the insulin regimen. If somebody is on once a day, takes insulin once a day, we sometimes tell them to measure once a day. If they're on 2 times a day, we ask them to measure 2 times a day. But sometimes we might even ask them to measure more than 2 times, depending on what we want to achieve in that individual patient.
Okay.
For those ones on tablets, most especially tablets that do not really lower blood sugar too much, what we call hypoglycemia, sometimes the monitoring is relaxed a bit. This can be about twice or thrice a week. So for tablets, people on tablets, the monitoring is relaxed. For those ones on insulin, we do it more frequently and emphatically.
Okay. So how exactly what should one do to prevent themselves from getting diabetes, Dr. Puloya?
Once we prevent type 2 diabetes, it's possible that you will prolong the onset. Sometimes it's inevitable that someone may get diabetes, but you may prolong the onset of diabetes. Stopping smoking, early frequent screening. So because we said that some patients actually may not know they have diabetes because they have no symptoms. Anyone above 45, the risk is high, so you have to have your annual screen. And when you're found to have pre-diabetes, just before you get diabetes, something can be done with evidence now. And also, then you're allowed to screen more frequently if you have pre-diabetes.
Maybe as we conclude, maybe you both belong to the Uganda Diabetic Association, and we are in the month celebrating, commemorating the fight against diabetes. Maybe it would be good to also inform the public what exactly the association has done and how far we are going in this fight against diabetes.
President.
Maybe Dr. Lumu, in the capacity of the president of the association.
As Uganda Diabetes Association, the viewer, this is an NGO, a non-government organization that unites and fights for people living with diabetes and their relatives. So we have a number of activities which we do annually in the Diabetes Month. The Diabetes Month is November. So on the 9th of November, we are going to be having a scientific conference, and this scientific conference is for health workers. We are going to be discussing a lot of the latest science in diabetes. So we are inviting all doctors, health workers to come to Fairway Hotel. We shall start at 8 and end around 5. Then we shall also have on the 14th, the Minister of Health, in conjunction with Ugandan Communicable Disease Alliance, African Diabetes Alliance, and Sonia Nabeta Foundation, we shall have celebrations in Mubende at Mbende Hospital, where we shall have a diabetes walk, we shall have screening of the general public, we shall do awareness talks to people living with diabetes and the general public, and lots of many other things. So we are inviting everybody around Mbende and even from Kampala to come. We expect to have our branches. Our association has 26 branches. So we've lined up different structured health education talks, and each branch is going to champion an aspect of diabetes they're going to talk about.
Okay, so we want to thank our guest panelists for the evening, Dr. Piloya Teresa and Dr. Lumu William, who are both take care of patients suffering from diabetes. So they're here to raise awareness about this condition. And remember, it is always important to go for early screening. Remember, diabetes tends to be a quiet disease, or it can present as early as even in childhood, someone can get diabetes. So it's always important for one to go for screening and get your blood sugars checked. And if you have diabetes, there are certain steps that the doctor will help you go through in order to bring that, the blood sugars in check. And if you do not have diabetes, again, it's always important to keep your weight in check, watch what you eat, make sure you get involved in physical exercise, and in that way you can prevent catching this disease called diabetes. We want to thank you again for enlightening us on this important topic, diabetes, and we look forward to joining you at the celebrations in Mubende. And to our viewers, please, you can always join the doctors and the patients in Mubende for this exciting march and fight against diabetes. Again, you're watching the DocTalk show. Send your questions, your comments or queries on our social media platforms, and we shall ably respond to each and every question.